Hello everyone, welcome back. Glad to have you. Welcome to my channel on Sessions with Dr. T. Lawrence, where we speak about all kinds of things where we can grow together. Today's session, I wanted to give some attention to bipolar disorder. Bipolar disorder, I wanted to speak more about the misconceptions of bipolar disorder. When you think of bipolar disorder, your automatic thinking is mood as far as like this person's in a bad mood, they must have bipolar disorder. Or oh, they're moody, they're sad, they must have bipolar disorder. And it's just like the wrong way to characterize bipolar disorder, and it could be very offensive to someone who is truly suffering from bipolar disorder. So today I want to get the record straight. Bipolar disorder is characterized as having extreme mood swings. It's a very hard mental illness to diagnose. However, it can be diagnosed, and if it is diagnosed, it can be managed. When I say extreme, I'm speaking about it's like out of the ordinary, it's uncontrollable. Is to the biggest extent. So for example, if you're suffering from bipolar disorder and you're in a manic phase, you can be an individual who may, for example, get $100 and shop for the whole community. That's considered manic. If it was the opposite and you were considered depressed, you may be an individual who may be very sad, very down, isolated to oneself at days and weeks at a time. It is not something that just happened out of the ordinary, just out the blue, just happened one time and that's it. Now you're bipolar. No, it doesn't work like that. It's very hard to diagnose bipolar disorder. You want to keep in mind you're speaking about extreme moodiness. Bipolar disorder is categorized into three. You can be diagnosed with bipolar 1 disorder, you can be diagnosed with bipolar 2 disorder, and you could also be diagnosed with kleptomania, which is mixed and more of a duration of the mood that lasts for about over 2 years duration. But going back to bipolar 1 disorder, what makes it so extreme and what makes it diagnosed is the fact that you are experiencing at least one episode of mania. And mania is just having like symptoms that are hyperactive, that are considered talkative. It's just more excited level. So that would fall under the category of bipolar 1. If you have at least one episode of mania, and once again, it must last a certain amount of days. It's not something that just happens one time. I'm only giving a snapshot of this. There is a lot more involved when it comes to diagnosing of bipolar disorder. For bipolar 2 disorder, that occurs when you have hypomania. Hypomania is just a little less excitement. It's a little less hyperactivity. And also you have experienced a depressive episode. So having those two there would probably consider bipolar 2 disorder. Again, this information is just educational and to inform you. It's not good to go around and just make blame and point to bipolar disorder for a shift in mood change. Sometimes our mood change is appropriate to the circumstance. It doesn't necessarily have to always connect to something is wrong with the individual. When you think about bipolar, the best thing I can tell you is think about it from an extreme standpoint, and also look at it from the standpoint, how long is this extreme mood lasting? Those would be like the best signs to actually think about when you're considering if you should seek any professional help. So I wanted to give some clarity on bipolar disorder. One thing I also want to add is, did you know that is equal prevalence in males and females? And also know that the genetics of family and the family history is very important when diagnosing bipolar disorder. So it is a mental illness that one can get, and it can be managed. It's not something that can be just taken away from once you have the diagnosis. Unfortunately, it's kind of like diabetes. It's there. You have to learn to cope with it, understand your symptoms, understand how to manage living with it. And you can. People are able to have a great life. It's usually just a misconception of thinking that I have this disorder and it has more of an impact than the disorder itself. So it's just kind of coming to terms and going through the stages of treatment to understand your condition, where with bipolar disorder, you may be prescribed medication as well as psychotherapy. It works best to have both. And you should also know that if you are prescribed medication for it, which more than likely you would be, it's not something you can just go off of. You can't just remove yourself from the medication, because the medication does have an impact on you and it is helping you. If you just remove yourself from the medication, people tend to believe that because I haven't had an episode, I'm okay. Wrong. It is there. It still exists. And it's something that you just have to continue to manage, such as diabetes. It exists and you will continue to manage it. So please, I advise, if you have been diagnosed with bipolar disorder and you were prescribed the medication for it, please do not just stop taking the medication. Speak to a professional to try to find out what is the best way with coping and having this medication and being able to function. Just look at it from this standpoint. Regardless if it's bipolar disorder or any other disorder, the main goal that the professional seeks for you is to be able to function and your day-to-day routine like you did before. And if there is any misunderstanding that something is still not right with you and your day-to-day functioning, then it will just be a time to speak with that professional and try to figure out what can happen to make you function better. But don't take it upon yourself and take on a disorder and make it you and make it become you. It is something, it's hard to know that you are diagnosed with such thing, and it takes time to accept. But just know there are many, many, many Americans that have been diagnosed. I think it's about 3% at this stage. I may be incorrect with that have been diagnosed with such disorder, and they're living great lives. They manage it well. They're taking a medication. They may have therapy. Some just take the medication, and it's just kind of getting to that stage of acceptance. Once you have accepted, you're able to start actually living your life and not having the disorder live you. So again, subscribe to my channel. We're here to just learn and grow together. Thank you. This is Dr. T. Lawrence. Subscribe below. Thanks.